one of the things that really drew me to independent pharmacy was the ability to be able to take care of people and not be bound by a certain rule within a particular chain pharmacy. Just really not having Big Brother watching over me. So if a patient needs their medication for the weekend, I'm allowed to do that without fear of repercussion.
I like to tell people in the Sebastian River area there's about 45,000 people, and Theresa's pharmacy, Bay Street Pharmacy, is really and truly the only independent pharmacy in our area.
I think one of the ways Bay Street Pharmacy makes a difference is that we get to know our patients. We know them on a first name basis when they come in the pharmacy. They trust us, so they come in and ask questions. If something's not going right, often the pharmacist is the first line, even before the physician, because we're so easy to get to. They can walk in and ask a question, whereas at a physician's office, they're gonna get a receptionist, they might leave a voicemail for the nurse, they're lucky if the nurse calls them back. And I think that's one thing that sets independent pharmacies apart from any other chain pharmacies, is that we develop those relationships. I can have 2 pharmacists on duty, so we always counsel our patients. Even though it's a steroid, it shouldn't. Yeah, it shouldn't, because he's still on all those anti-rejection meds too. All right, so that's really it. So, in other words, we kind of don't ask them; we kind of mandate it. But that's an ability I have to do as an owner versus a chain pharmacy that typically won't allow that level of staffing. I think independent pharmacies in particular tend to be the backbone of many of their communities, where the owners or the businesses are so plugged in just so many different aspects. The American Cancer Society helps us with helping our patients to be pointed to an organization that's going to help them through a very difficult time. And Relay for Life is their major fundraiser, and it's a great team building experience for my staff. They really all jump in and help and really enjoy that. I had a nurse who was working for me on a part-time basis, and she had a background in nutrition. So we thought, well, we'll start a diabetes club and just have people join in. Good morning. Good morning. Welcome. This is the biggest group we've ever had, so we can give ourselves a round of applause. It's pretty, it's pretty exciting. This month we'll be talking about small steps and big results. So talking a lot about diet and exercise and the things that they do, how they can make a difference in their health. So type 1 is typically somebody who doesn't. I'm a firm believer that pharmacists are part of a team, and that we all have to work as healthcare professionals with the patient to take really good care of them.
I was driving down from Gainesville, Georgia, and I went to step out of the truck, and I went to grab the grab handle, and I missed. And I fell on my tailbone and broke my back.
This gentleman was discharged from the hospital on a weekend, and unfortunately his care was not coordinated. There was not a plan for his medicines to be filled, and he was on medicines that not every pharmacy carries.
I had a stock of prescriptions, and she went over here to the drugstore over here and basically didn't want nothing to do with her.
We fortunately were able to stand in the gap when they were not being taken care of the way they should have.
I'm on the phone to his nurse. I'm going, what can I do? You know, I've been to two pharmacists already.
They called our pharmacy, and they were not nearby, but my pharmacist was willing to stay open for them on that day.
She goes, if you can get here in 20 minutes, I'll take care of you. And so all she had to do was pick up the phone, start dialing.
Cheryl and my techs went above and beyond and called the insurance company, made sure that they got all of the billing straightened out.
They locked the doors, took care of my prescriptions, and came home with enough for the weekend. And she called me on Monday and said, okay, I got the rest.
This family who was left in a really bad situation on a Saturday, where they probably would have been without medicines for the rest of the weekend, or he would have had to have been put back into the hospital until Monday, which would have been a really big expense. We were able to take care of all of that for them.
I rave about them because they're just awesome. They are just awesome people.
Our tagline is, we're caring people care for you, and I have an excellent staff that just lives that out. It's great to be able to help people the way that and be able to treat people the way they deserve to be treated. I wouldn't be in any other profession. I count my blessings every day.